Up till now, the majority of our funding has been through a grant of a church. Actually, locally, the church sold their building and wanted to focus on a social injustice issue that affected their community, and so that gave us our starter grant. Now we're working on other grants, but that's where our funding our main source of funding has been, and private donations from the community as well.
Although programs exist to help homeless youth, without specific language identifying and validating the distinct problems LGBTQ+ youth face, there is no way to ensure enforcement and coverage. Amending legislation to fund and restructure the current youth homeless programs will provide shelter and programs with resources they need to aid these youth, including specialized training for workers to better understand how to help these youth and funding for basic services and to expand the reach of these programs, reducing the number of teens on the street and providing more specialized care. There are 3 main categories for programs: the Basic Center Grant Program, the Transitional Living Program, and the Street Outreach Program, with its subset, the Sexual Abuse Prevention Program. Currently, only a fraction of homeless youth benefit from these programs, especially LGBTQ+ youth. This is because these programs mean nothing without funding. The additional funding will not only allow for more youth being able to benefit from these programs, but will also provide training to staff and provide the youth with mental health care. The main reason youth cannot benefit from the Transitional Living Program is because of lack of housing. LGBTQ+ youth compose between 30% and 43% of those served by drop-in centers, street outreach programs, and housing programs, meaning that they are more affected by this. The lack of funding in many shelters results in them not being able to house many youth and leaves them at risk for the dangers they may experience on the streets. A national survey found that the lack of funding, particularly government funding, was identified as the primary barrier to improving services related to reducing LGBT homelessness. In another study, perceptions of social support, a sense of being connected to other people, and self-esteem in being part of a larger community, such as the LGBT community, were linked to psychological well-being among LGBTQ youth. LGBTQ+ youth who reported higher levels of family rejection during adolescence were 8.4 times more likely to report having attempted suicide, and 5.9 times more likely to report high levels of depression. The amending of the legislation will allow for them to have access to the help they need.